Welcome to the Health Links podcast, where we bring you conversations that empower healthier living. Welcome to the Health Links podcast, where we empower healthier living. I'm your host, DJ Thatcher. And in this episode, we're focusing on Alzheimer's and some of the latest treatment for it. Recent studies show that more than 7 million Americans over the age of 65 have Alzheimer's, and that number is predicted to double in the next 30 years. Doing a twofold podcast today, we are sitting at Alice's Clubhouse in Mount Pleasant. We're joined by its founder and president, David AvRutick. David, welcome again to the Health Links podcast.
Thank you, DJ.
I say again because we did an in-depth interview here at Alice's Clubhouse in the spring of 2024. It's episode number 89. So check it out for an in-depth view of what this is all about. What we're going to do then is bring in Dr. Todd Joye from InterveneMD to talk more about the medical side of Alzheimer's treatment and some interesting news on that front. Let's start with you, David. Give us a thumbnail sketch, though, of Alice's Clubhouse.
Well, Alice's Clubhouse is a medical model memory care day center.
Okay.
And we are the first in the state of South Carolina, and I believe we are still the only one in the state of South Carolina and one of the few in the country. And the reason Alice's Clubhouse exists, and Alice is my mother,
right,
who was diagnosed with Alzheimer's, is that while she was progressing along that path, we found that there was a gap in the healthcare system, really between having someone stay at home and eventually end up in 24/7 care. And my father was her caregiver, and he was convinced he could do everything himself and realized along the way that that was just too much. But he wasn't willing to have her go to a care facility. And along the way, we had met someone who had run a day center for folks with dementia in Connecticut. And she was attempting to create something here in Charleston, but did not succeed. And we decided that really was something that was necessary for the people in the Low Country and certainly, and hopefully beyond.
Sure.
And so we opened up in 2019 and survived the pandemic,
right.
which was
talked about that.
Yeah, which was not a insubstantial accomplishment. And we've now, we have our members. We don't have patients, and people come to the Clubhouse where they everything we do is intentional. It's all based on physical and psychosocial therapy, essentially, where they receive both the physical and mental stimulation that has been proven, and as I know we'll be talking about, has not only can stabilize them, but even reverse for a time the progression of the dementia. And we've been incredibly successful at it, that we have people who come here on walkers and after going through the program for a while, do not need walking assistance. We have people who come here who are not really able to hold a conversation or remember their relatives, who regain that memory, regain that ability. And it is all about, it's a magical mix of a variety of things, but that socialization, the physical engagement, the daily need to understand that they have a place to go and a purpose changes their lives. And then in turn, all this changes their families' lives and their caregivers' lives, because everyone sort of recaptures what they were losing along the path. And the caregivers lose just as much in terms of the time, finances, everything else that affects them. And so in a nutshell, that is what Alice's Clubhouse does.
And so once again, the members come in the morning time. There's a window around 8:30 to 10. They come, they spend the day, they go back home, obviously, later in the day. You mentioned that you're offering other services here too, podiatrists and hair care and things like that, so that this also gives the family member or the caregiver a break as well.
Exactly. Everything from physical and occupational therapy to getting their hair done. A podiatrist will come. Things like that the caregiver would have had to have done on their own, scheduling appointments, traveling, all those things, which actually can be fairly difficult with someone who does have dementia. And all that can be done here. And so that, again, frees the entire day up for the caregivers. And it's done here just, as part of the day here. And it allows everyone to reclaim much of their lives that way.
Well, so David, this really is a mission for you. We can see that. And again, check out episode 89 for a full in-depth overview, including some video of the services provided here that are helping. So our purpose in getting together today is also to talk about this collaboration you have with, again, Dr. Todd Joye from InterveneMD, just across the parking lot from where we are. And Dr. Joye, welcome, and tell us about InterveneMD, what that's all about.
Well, I grew up in Mount Pleasant, actually, and have been practicing orthopedic and spine medicine for years. A lot of that initially was steroid shots and sciatica and those types of things. And I started realizing along the way that people were not responding as well to the steroid shots. They weren't lasting as long. They would keep coming back for more shots. I started gradually understanding that it's not just, you're not fixing a body part in isolation, that I can't fix someone's back or I can't fix someone's knee optimally unless you start addressing the environment that healing is taking place in.
I see.
And that took me down a road of incorporating other features into my office to try to address that and really looking at the body from a sort of a root cause. I think that, and over the years, I just become more immersed, more curious, more passionate, and about learning about the body. I think that one of the things that is lost in medicine right now is a sense of awe at really how the body works.
Okay.
All right, and if you think about it, your body can recognize a virus that it's never seen before. It can identify it as foreign. It can mount a response, remember it forever, and then kill it faster next time, which is extraordinary for the body. On the brain side, you know the brain only operates on about the energy of a 20-watt light bulb.
Oh, wow.
And yet it outperforms the most advanced supercomputer ever made. With things, it creates memory, obviously, emotion, empathy, identity. And so we wonder why the brain suffers in a toxic environment. And so all this stuff kind of came together for me at trying to figure out how we handle this in this type of environment. I found out a few years ago that I had one of the genes for Alzheimer's. I'm happy to get into that. You know, the genes are, there's a common gene that's called the APOE gene.
Okay.
And you get one copy from each parent. So you can have the number 2 gene, the number 3 gene, or the number 4 gene. If you have the number 4 gene, that's a higher than normal risk of Alzheimer's. If you have the 3 gene, it's a normal risk. The 2 gene is less than normal.
I see.
So, so I have one of those 4 genes.
Okay.
So that puts me at elevated risk for Alzheimer's. But I also have learned that 40% of all Alzheimer's cases are in people that don't have the gene. So it's environmental. And that kind of, we talked about COVID a minute ago, or mentioned it, that was kind of epiphany for me as well, because COVID was really a terrible thing. But, you know, I think our bodies really should have fought it off better. We're not living correctly. We're not exercising.
Sure.
There's too much Roundup on our food. The plastics in the environment, they're finding plastic particles in brains and testicles and ovaries. The food supply stinks. And so all that relates to Alzheimer's as well, and this spike in these cases that's get predicted to increase. So so I found out I had that, and I knew that I had to incorporate that, because if I can fix someone's brain and help them along the way, then I will end up helping their back and their joint. And so that's kind of where I came from with this, and just addressing the cellular environment of the body, because our body is smart enough to fix itself if we give it the tools to do so.
This whole conversation came out of an article that was just in the January-February 2026 issue, as we recorded this, of Health Links magazine. And so what we're looking at here is Alice's Clubhouse, which has provided some terrific therapy, I guess we could really say, for your members who have Alzheimer's. And a lot of people think that this is inevitable as we age, that we're going to have Alzheimer's, dementia. We could talk about the difference there between those. But what you're really talking about here, Dr. Joye, is the fact that much of this is, number one, preventable, but also treatable outside of the typical give me a pill or something like that. Let's dive into that a little bit more. First of all, how about that difference between Alzheimer's and dementia from a medical standpoint?
Well, there are several types of dementia.
Okay.
Alzheimer's is the most common type.
I see.
There's also vascular dementia, something called Lewy body dementia, and then a what's called a frontotemporal lobe dementia.
Okay.
So Alzheimer's it gets the lion's share of the notoriety. It's a there's a big fear about that. It's expensive. Nobody wants to lose their brain, and we're kind of here. And part of this partnership with David is that we're not promising a cure, but we are promising brighter days that we can manage that correctly and help minimize that risk. And I look at what we do in my clinic in kind of 5, buckets of things we look at. To speak to what you asked, one is cellular health, one's metabolic health, one is what's called neuroplasticity and signaling, in other words, the brain and neurons. One is oxygen and movement and circulation.
Okay.
And then the 5th one is social interaction and caregiver support, actually, that Alice's does as well. And so we're really, on the cellular side, we're looking at cholesterol. We're looking at these things called plasmalogens. Everybody knows cholesterol. In a lot of cases, it's overtreated. People need statins. Your cholesterol needs to be controlled. There are certainly cases like that. But if you look at all-cause mortality, you have the least chance of dying with a total cholesterol over 200 and an LDL cholesterol above 100. And usually that's put you on a statin.
Okay.
And that by lowering cholesterol too low in some people, we're causing Alzheimer's and cancer and autoimmune disease.
Because the brain needs that. Correct?
The cell, so your cell membranes need cholesterol and plasmalogens. It makes them fluid, what we call fluid, makes them resilient, makes them able to repel viruses and toxins and repair the body. And so you have to have that part of your cell membrane intact. And so that's kind of the cell function, and also taking care of oxidative stress in the body.
Okay.
And then the metabolic part is huge these days. Now I'm talking insulin resistance and glucose. What's everybody think about then is the GLP-1s that we take, right?
That's the Ozempic and that
Exactly.
type of thing, right?
And so those have been vilified recently a little bit with muscle loss, which is a shame because almost everybody should be on those medications. The GLP-1 medications like semaglutide and tirzepatide are in final clinical trials right now to prevent Alzheimer's.
Huh.
There are GLP-1 receptors on cartilage, so they're terrific arthritis drugs. They reverse heart disease. They're anti-cancer. And so terrific drugs. And you have to be monitored correctly and see the right physicians to put you on that. But that's the metabolic part. The neurologic part is we're doing a lot of stuff with these wonderful amino acid groups called peptides to help the brain work better. The exercise part and oxygenation is huge because resistance training is critical for brain health.
Okay.
It's critical for life. When you lift weights, your muscles get bigger. It pulls glucose into your muscle. And now they're calling Alzheimer's type 3 diabetes
Right.
because your brain can't use glucose effectively. And you gain muscle, you make more mitochondria, which make more energy, which helps your brain work better. And then, of course, there's David's component, the social part, which is huge. Because I think, personally, I think you probably would agree, that we are in an epidemic of isolation. For a society that says we're so connected, we're not humanly connected.
Right.
We're spending more time isolated. We got movies on Netflix. We text people instead of calling them. We don't go to neighborhood cookouts. Our houses are further off the street. We just don't interact anymore.
Sure.
And that's a shame. And so I think the great thing about Alice's is it does bring that social connection piece back to the table. So those are kind of the buckets I look at.
Okay.
And people fall on different ones. But that's what's fascinating is I tell people, don't be discouraged about this. And hope is not a strategy
Right.
for a cure for this.
Heard
You
that.
got to get out there.
Yeah.
You got to pursue this. You got to meet people who can educate you on it.
And the point that Todd just made about the isolation is really important for what goes on here. That we find that when a family gets a diagnosis of some form of dementia, it first
Okay,
goes...
say that, by the way. The family gets the diagnosis.
Yes,
They really do.
absolutely.
Keep going.
It first goes to shame. Well, first it's denial. No, they're just getting older. But then it goes to shame. Don't tell anyone. And that isolation starts. And as the person becomes more affected by the disease, their world gets smaller, but the caregivers are afraid to go out into the public. And so as that isolation kicks in, the problems multiply, and they multiply for everybody. And that's really part of what happens here, is that gets reversed. Because not only are they socializing, they're socializing with people who have similar issues, and they recognize that amongst themselves. And so their level of comfort, their level of openness and connection just increases far from where they were.
I see.
And when you take everything that Dr. Joye is just talking about, and then he's able to address the beginning of the path, we're able to address, as you've progressed down the path,
Sure.
and the combination is just incredibly powerful. And we have, not only do we have some of our members that go to Dr. Joye, but their families have started to go because they see the benefits in exactly what he's talking about.
Well, now this collaboration between Alice's Clubhouse and InterveneMD began about 6 months ago. And last summer there was a study backed by the Alzheimer's Association, the
Pointer study.
U.S. Pointer study. Yeah, and we talk more about that. But it basically established that link between what you're doing here at Alice's Clubhouse and slowing, or even maybe in some cases reversing, the effects of Alzheimer's. There's some of the things that have a note here. It involved things that we talked about already: exercise and the diet. But in particular was the MIND diet, which is basically a Mediterranean diet, along with an antihypertensive or anti-high blood pressure diet and so forth. So what are some things there for either of you that the average person listening, who maybe doesn't even think about Alzheimer's, doesn't have anyone in their family experiencing this, but they want to reduce their own risk? What are some solid, some things that have solid evidence behind them that can show that it might reduce our risk of developing this later in life?
Sure. I think the easiest option to do for people is to lift weights.
Okay.
That's the number one longevity thing for living long anyway, not to mention
And do you
Alzheimer's.
have to be a jock and do that, or is
You
it?
don't.
Is it it's,
You don't.
yeah,
Now,
that scares people.
no, you don't have to, but walking after meals is not really going to cut it. You need to walk after meals because that pulls your sugar into your muscles. That's important. But don't just say, I'm going to walk after my meals and do nothing. You have to lift weights.
Okay.
That increases your mitochondria, increases your muscle density. Along that line, most people need to be on creatine.
Okay.
Now, creatine is not going to make you Arnold Schwarzenegger. All right, a lot of women need creatine. That helps you build muscle. People on the GLP-1s aren't taking creatine, so they're losing muscle. And so that's very inexpensive. Those are two of the things. Now, you need to get cholesterol looked at. The plasmalogens are fascinating because these are omega-3 and omega-9 fatty acids. If you look at the studies on plasmalogens, if you are a 90-year-old with high plasmalogens in your blood and a 60-year-old with low plasmalogens, they both have the same 5-year survival. So plasmalogens having high levels in your blood can equate to 30 years of life.
And what do they do again, the plasmalogens?
They're fatty acids, and so you're basically have to get these in you to protect your cell membranes, but also to give your brain non-glucose for fuel, to convert the fatty acids to fuel instead of using glucose.
You mentioned the mitochondria or mitochondria. They're kind of like the energy cells within, or energy packs within
they're
the cell.
powerhouse. We all learned that, right? Powerhouse of the cell.
Right, exactly.
Right.
So we talk about, just going back for some practical guidelines for people lifting weights. I know that a lot of people will recommend just doing body weight squats and things like that, just their own body weight. If we are lifting weights, does it have to be something really heavy resistance or a 10-pound type of thing? Or
Not
what
necessarily.
you found? Okay.
Progress beats no progress.
Okay.
You know, you can do stuff at home, certainly easy, and that does it. You can go to the gym and do weights.
Sure.
You need to, sometimes intermittent fasting can be helpful. Again, we all had, at least when I was growing up, we all kind of had a little Debbie cake in the glove box or something, and so you always access to food all the time. So depending on your Alzheimer's risk, your genetic risk, you need to go 12 hours or maybe 14 hours without eating, and that forces your brain to use these fatty acids for fuel.
Right.
There's wonderful products called ketone esters, which were developed for special ops soldiers, which help your brain work better in stressful situations and to extend a fast. And then the diet part of it, we need to get over the idea that eggs are bad for you,
Right.
and that cholesterol is bad for you. You need to have choline from eggs. If you can eat organ meats, when I was growing up, I hated it, but my mom would make liver,
Right,
periodically,
right. Yeah,
right?
same here.
So organ meat, grass-fed,
Yeah.
organ meats, those are terrific, and grass-fed meats. It's hard to give your brain the fuel it needs on a vegetarian diet. It's doable, but it's very hard. And so those are, kind of easy things to do. Of course, when we see people, we do specialized blood testing and can measure plasmalogen levels and can replace things pretty accurately based on those levels. But in everything that I do, whether it's orthopedics or this, I'm more treating function than a problem.
Okay.
Someone has a disc problem, I'm not going to necessarily make the disc get better, but I'm going to improve their function. And same thing, we want the brain to work better.
Sure.
We can do different tests for that and IV infusions and things. But it's beatable. And I think that the way traditional medicine is with this is that we are always trying to fit a medication to a disease.
Mm-hmm.
And we're trying to live longer with the disease instead of using our biology to fix the disease. And that's just so what's fascinating about
that bears
looking at this.
repeating, but that is so that is so true.
Yeah.
We've obviously done a lot of podcasts over the past year, for example, on different topics, weight loss and functionality. And what you're saying is a common theme that we've heard many times. So it's insulin resistance, which is an issue. So getting out, walking, helping to, as you just mentioned, helping the body absorb that sugar where it needs to go, not storing it as fat. The diets, the processed foods and things like that. You mentioned earlier about the microplastics that we get.
Right.
I think I've read that we all consume like a whole credit card worth of plastic every year, whatever the
I've seen
stats
that
might
too.
be.
Yes.
So there's all of these preventative things that we can see. Have there been some hardcore results from any, whether it's the U.S. Pointer study or anything else, that shows that hey, if you follow this path, it can reverse these signs or symptoms of Alzheimer's? Don't know.
There may be some on the social side David has seen.
Mm-hmm.
I know that the studies on plasmalogens have been great. The initial study for plasmalogens were done out of the Rush University in Chicago.
Okay.
That does have some nice data on that, as I said, with the plasmalogen levels in 90-year-olds versus 60-year-olds, and improving lifespan, but also in helping the brain work better. And those studies, there are even studies ongoing where I have some colleagues of mine that are in studies taking high-dose plasmalogens, and they're showing that their brain is getting larger. And so that's really encouraging. And of course, there are studies, medical research right now is doubling every 2.5 years.
Right.
Our knowledge. Years ago it was every 10 years. And so it is staggering what's out there. And so, it amazes me. If I spend 1 hour a week, I probably spend 20, outside my job looking at stuff and going to conferences and learning all this stuff, because it's just fascinating to me how the body can take care of itself. And it's not, in Alzheimer's, we have to get away from thinking that the brain is really the problem. It's that the brain is living in an environment that's toxic. And even the amyloid that we're going after with medications, removing amyloid, like these drugs do now, is like blaming a firefighter for causing a fire.
Okay.
Everybody says, I see a fire truck, I see a fire, so the firemen must be causing these fires. The amyloid's not causing Alzheimer's.
Great analogy. Yeah.
It's the deeper down stuff with your mitochondria, with your inflammation, with your immune system, with your vascular system. It's all that that's contributing to this, and you have to look at that. And if you look at that, then this is a disease that can be prevented. Another point with this, just for the audience to know, is that when you have these genes for Alzheimer's, they are modifiable. There's something called epigenetics, where if you have the gene for Alzheimer's, you can actually control whether that gene gets expressed. You can control whether that gene even gets expressed to your offspring.
Interesting.
If you do things to control it down the road.
Okay.
A simple analogy is if I'm prone to sunburn, what do? Well, you put sunscreen on, you wear a shirt, you don't get sunburned. And so there are ways to control this, to mitigate this risk of Alzheimer's. So
Okay.
it's, I never want people to be discouraged about this,
Sure.
because we want people to be proactive with this. We also realized that years ago, Alzheimer's had these categories where you had normal cognitive function, you had subjective cognitive impairment, you had mild cognitive impairment, and then you had Alzheimer's. So there were
Oh, I
four
see.
kind of categories. And so subjective impairment is called SCI, and that's when the individual knows there's a problem, but no one else does. You know inside, I got a problem, but you don't want anybody else to know. And then mild impairment, MCI, is when people start noticing around you.
I see.
Then there's
Okay.
full-blown Alzheimer's.
Yeah.
And so the problem with that is we actually are trying to change that diagnosis to make MCI Alzheimer's.
I see.
Because
Okay.
by the time you're diagnosed with Alzheimer's, those problems have been there for 20 years. So if we can recognize that when you get mild impairment and say, you've got Alzheimer's, that can force people to say, I got to look at this, rather than kicking it under the rug and being ashamed, and not having that social outreach
Gotcha.
that they do here. But changing that paradigm so we get people seen early. So I love seeing people when they're in their 40s.
Yeah, I was wondering, so what is your goal here with the collaboration that you
Just to go back to the pointer
Yeah, go
study
ahead.
for a second, my biggest takeaway from it, and Todd is certainly able to read much more into it than I can, but my biggest takeaway from the pointer study, which I believe the Alzheimer's Association spent $50 million on,
Wow.
was don't wait too long.
Right.
Take action sooner. And in the part where they were focusing on are people who were at risk. And what can you do when you're at risk before you actually develop the disease? We're at the point where what we deal with is people have the disease, but the exact same thing applies here. The longer someone takes to come to Alice's Clubhouse, the less effective we can be in helping them.
Just like anything.
And so there are folks who are diagnosed who have a mild case, who go, oh, I'm okay, I can deal with this. But that's the biggest mistake they make, because if they come here sooner, they will get the greatest benefits. They'll be able to stay at home longer, they'll be able to function longer. And to me, that's what the pointer study is saying,
Okay.
is don't wait too long. Don't be afraid of it. Don't hide from it. Don't be embarrassed by it. And what you can do with Todd is really address things earlier on. But the exact same thing applies once you have the diagnosis. And it's so unfortunate. We've had people come, and this is not terribly uncommon, who have come here, they've done a trial day, and they say, we don't think we're ready for our father, mother, husband, wife to come to Alice's Clubhouse. They'll call us 6 months, a year. It's been up to 3 years later saying, we're ready now. And we'll say, you've waited too long. And we can't help you now because you waited too long. And if they come when they know it, they'll find a community that is supportive of them. They'll find the benefits that they wouldn't have otherwise. And that's the essence of the pointer study to me.
That's a good sell, so to
Yeah.
speak. I would imagine that David, most people have come here now since you opened in 2019. Families who bring their loved ones here, the members, they've been diagnosed with Alzheimer's from another medical entity. And I would imagine that part of your collaboration right now with InterveneMD and Dr. Joye is to encourage people to come in earlier, maybe start with InterveneMD, I would imagine, and maybe make some adjustments. I don't know. I'm just
Well,
curious.
it's certainly part of, we have people who come who just want to talk.
Right.
And they find a very sympathetic ear here. And when you're confronted with the diagnosis of a family member, it's like, oh my God, what do I do? And there's certainly lots of folks out in the senior community who can help, and they're wonderful people, but people find us. And as one of the tools that we have in our toolkit is to say, there are other things you can do besides coming to Alice's Clubhouse. And we do provide an introduction to InterveneMD as well.
What might be helpful for the audience is maybe the top three, so to speak, recommendations for someone who has already been diagnosed, may be coming here to Alice's Clubhouse.
That's certainly number one.
Yeah, right, that's number one. What can they do to reduce their symptoms? So that might be one path to go down. The other is top 3 recommendations for any of us who maybe don't have a background or a history rather of Alzheimer's, what they can do to help stave that off. You mentioned lifting weights, but let's start with a group that already has a diagnosis of Alzheimer's. Top 3 things they can do to help prevent, or not prevent, but treat, or maybe even begin to reverse some of those symptoms.
On the medical side,
Mm-hmm.
The resistance training is critical,
Okay.
regardless of the stage.
Okay.
These days, I would encourage them to consider being on a GLP-1
Okay.
medication.
So again, like an Ozempic type thing.
Exactly. Tremendous results coming out with that.
Okay.
When patients come see us in those stages, we are looking at ways to try to speed things up a little bit for those folks. Hormones can be a big deal for just getting estrogen, testosterone normalized. And unfortunately, 20 years ago, there was a women's health initiative study that came out saying hormones cause cancer. And that's not true.
It was a brutal. We had a podcast on that.
And everybody picked it up and ran with it. And then 2 years ago, they refuted that data, and nobody picked it up.
Yeah.
You know, and so that's critical. Coming in and having us address even their sleep. You know, in addition to the hormones, we can do blood testing and establish these plasmalogen levels and other risk factors and try to correct them.
Okay.
It is much harder, you know, to do that.
Well, once you have the diagnosis,
Yeah,
sure.
but I think whether you have Alzheimer's or you're young, I think the recommendations are kind of the same, except we got a shorter fuse on the Alzheimer's diagnosis people. But on that list also is getting information. Come in. Everybody is in a different situation. Find out what their goals are, what their family situation is. Do we do blood testing? Do we fix something initially? There are peptides we can do that will improve someone's situation, sometimes fairly quickly. The plasmalogens can turn things around fairly quickly in people. Sometimes they don't. Sometimes they got to move to something else. And so everybody's kind of unique in what they do. But it's just fascinating to be able to sit down with them. But exercise goes across both of them.
Okay.
That's critical. The social part of it, we want to try to rewire those pathways. And then I'd say hormones and diet.
Okay. So don't assume that this is just a natural part of aging, that, hey, this can be treated. Get in here and get, as you're talking about, you're obviously an expert in this area. You know, get those medical tests and find out what else might assist.
Right. This is not, Alzheimer's is not your destiny.
Right.
It is not. You've got things that we can proactively work on to get your brain to work better, that we can't do in isolation, that we got to work on energy, we have to work on oxygenation, we got to work on signaling, and we got to make your brain feel safe.
Okay.
And it's not feeling safe right now with everything that we're dealing with.
You know, I'm curious what the Alzheimer's Association nationally is doing. 'Cause David, you mentioned this is the first type of dementia-related daycare center in South Carolina, one of the few in the country, in your practice as well. It's funny, you're on opposite ends of the same parking lot. What is the Alzheimer's Association doing to promote this type of joint venture, so to speak, all over? Identifying, maybe establishing other types of Alice's clubhouses or a medical practice that really specializes in this. I don't know if they're doing much or not.
We're working with the local chapter of the Alzheimer's Association to actually expand the knowledge about these things. We are not the only day center in South Carolina. We're the only medical model one.
Okay.
You know, respite care, things like that exist, which are wonderful, but they're limited by statute and limited by their own abilities to what they can do. They're fabulous for what they do. We just take it to a much higher level. But the Alzheimer's Association tends to be focused more on awareness and understanding and funding research and things like that. But you know, we certainly work closely with them and are very proud supporters of the Alzheimer's Walk and raising money for them for what they do. I do think they have a great soapbox, and pointing people towards programs like ours would certainly be something, and I imagine that will come out of the Pointer study results as well. We're trying at the moment to figure out that with them about where that fits into their messaging.
Terrific.
But it is something that I do think they should be louder about, and we can help them with that.
Well, we have viewers who join us from the Midlands, from the upstate, and of course beyond South Carolina as well. They might be thinking, man, I wish we had this in our area.
I don't think that they, obviously any platform, any word we can get out there is, won't be turned down. The awareness is so important.
Yep.
I'm not aware, I have colleagues across the country that are doing similar things that I am with this information, trying to improve people metabolically and immune system wise and all these other buckets I talked about. But I'm not aware of any collaboration like this among my colleagues. And so I hope other people do it. I think there is a great need for that. As good as my staff is in technical parts and doing the lab work and interpreting it, we're not the best place to socialize, with people. And so I think this is a great place to incorporate that.
Well, this has been very enlightening and hopefully to people who are viewing this. So we do thank you both. David AvRutick from Alice's Clubhouse, Dr. Todd Joye from InterveneMD. Thank you so much for joining us here on the Health Links Podcast.
Very much.
Thank you, DJ.
And join us next time with the Health Links Podcast as we engage in another conversation that empowers healthier living. I'm DJ Thatcher. Thank you for joining.